Looking at the Palestinian context, as you can see, Palestinian community have been under occupation, Israeli occupation, for over 5 decades. Now, the manifestation of that occupation has affected every aspect of the Palestinian life. And we can see that in terms of like military control over natural resources. This is very acute in the case of the Gaza Strip, which has been under blockade for the past 15 years, but also in the Area C in the West Bank, which is a very fertile areas in the West Bank and responsible for over 60% of the food basket in West Bank. But there is also more restriction on movement of people and goods, whether in the context of the Gaza Strip, but also in the West Bank. And I'll show a picture of that has been done by B'Tselem that looks at the Palestinian territory and where are the control over these Palestinian territory. As you can see in the map, the Palestinian territory in the West Bank is divided into specific areas like Area A and Area B, which is under the Palestinian control. But Area C, that is considered the food basket, is very wide, yet it's also very controlled by the Israeli occupation. You can see the gray areas is considered closed military zones, which is also natural reserve for Palestinians. And all the red dots on the map are checkpoints that people have to go through as individuals, but also as products and services and goods that is entering from one city to another, but also entering the Gaza Strip. Now, of course, the Gaza Strip is blocked, so you only have some checkpoints that is looking at only the entry of people and entry of goods. Now, looking at another layer of the impact of the Israeli occupation, that you have multi-layered complexity that affect the lives of Palestinian communities. So you have basically human rights violations. You have displacement, particularly in Area C in the West Bank, displacement of Bedouin communities in Area C. And you also have economic collapse within the whole Palestinian economy, as well as very restrictive access to health services. And this is very acute in terms of Palestinian living in the Gaza Strip, in terms of accessing a good health services. Now, what also characterizes the Israeli occupation for Palestinian community in Gaza is that you have a military offensive, Israeli military offensive happening like in a very recurrent way, where you have 4 military offensive in the past 15 years only in the Gaza Strip, that resulted in a lot of destruction in infrastructure, but also in the community's household units and industrial aspects. Now, what that puts us in a way that 40% of the Palestinians in the occupied Palestinian territory require humanitarian assistance. Now, that percentage is very high in the Gaza Strip, where 65% of Palestinians in Gaza are requiring humanitarian assistance. That same percentage fluctuates based on the years, and also affected by the amount of humanitarian aid that is being given to the PA. And also we have unemployment rate standing at 25%. But if you look at the labor force participation, you will find huge gender gaps, where female participation in the labor market is 16% compared to 65% for male in 2020. And this is according to the Palestinian Bureau of Statistics that looks only at formal employment. Now, when it comes to a bit deeper into the Palestinian distorted economy, the Palestinian economy is very dependent on aid flows, and it's a very politicized aid flows. It's one of the most aid-dependent countries. In 2008 alone, about 32% of the GDP was coming from aid. Now, looking at that, and also looking at poverty rates, where about over 34% of the population is living in under poverty rate, food insecurity overall in OPT is also 1/3. Again, if you zoomed in a little bit on the Gaza Strip, it is actually more severe with food security over 60% of the population. Now, if you look at what kind of aid that donors are providing in terms of in the case of OPT, you will find at the early of 2000s, most of the aid was going towards like security sector reform and state building. About 1/3 of the aid was directed to security sector. Now that goes for paying salaries for the employee in the security sector. And that affects the amount of funds and budgets that goes into social and addressing social and economic needs. Now, also prior to the pandemic, the Palestinian Authority, there has been a lot of physical uncertainty. Now that there are many factors that have affected the physical uncertainty or increasing that uncertainty. One is related to the U.S. suspension of assistance to UNRWA that was taken as a decision in 2008, but also Israeli withholding Palestinian tax revenue transfer, which constitute about 75% of the total trade revenue in 2019 and also 2020. Now, that resulted in the PA borrowing more from domestic commercial banks, but also that resulted in cuts in public employee salaries, including essential care workers. Now, if you look at the case of OPT, you will find there are very high dependency of Palestinian household on wage salaries that is coming from public employees, not only as an immediate family, but also having this public employee supporting his extended family. So that resulted in exasperation in the entrenched poverty trap that Palestinians are suffering from. Now, taking all this in consideration, and all this snapshot is prior to the COVID, and I will get more into like the impact of the pandemic on these indicators. Now, the whole paper was looking and focusing on care work, both unpaid care and domestic work, but also underpaid care work in Palestine and Palestinian context. If you look at the unpaid care and domestic work, just like other countries, it's a very feminized work. It's looking at unpaid care and domestic work as an extension for women reproductive health. And in OPT, Palestinian women spend 5 times men on unpaid care and domestic work. Most recent statistics that is done by NGOs research is saying that the percentages increase. It's more likely that it's a woman spend 7 times men on unpaid care and domestic work. Now, there are several factors that resulted in the increase of the care needs in the Palestinian communities. One of them, and fundamental one, is the recurrent Israeli military offensive. Now, if you look at the case of the military offensive that happened in 2014, you will find that there are about 10% of the people who were injured sustained like long-term physical disability. Now, having that into consideration while also looking at the collapse of the health sector in Gaza, it means that only the household will bear the responsibility of taking care of all these needs of the people with disability due to the military offensive. The same goes for the Great March of Return that took place in 2018 and 2019, that also resulted in severe injuries and disability due to a specific targeting of Israeli military to Palestinian young people, limbs like arms and legs, that render them unable or require a long-term of rehabilitation to be able to enroll in the community and provide active participation. Another element is the power outage in Palestine, but like particularly that's a chronic issue in the Gaza Strip, with electricity crisis for the past 15 years, with an average of 6 to 8 hours a day for Palestinians. But also in Area C in the West Bank, there is limited access to infrastructure that also deprive whole communities from access to electricity. The displacement also increased care responsibility because women will have to shoulder the impact of not having these access to resources, going very long distances in order to obtain water, and also taking care of their children. Now, that is coupled with decline in public service coverage due to the deficit within the public budget and higher poverty rate. So due to the higher poverty rate, people cannot even purchase care-related services from the private sector because they cannot afford it. And lastly, climate change, particularly in rural areas and agriculture sector, we have witnessed that there is an increase of heat wave and drought and flooding in some areas that result in an increased labor on women and girls in terms of unpaid care and domestic work. Now, as I mentioned, the poverty rate is very relevant to people in ability to purchase health expenses. So even though there is a public health insurance, you will find that Palestinian families still spend and pay for about 38% of their healthcare expenses. Now that's focusing on the unpaid care and domestic work. If we took a look at also at the paid care services within OPT, you will find that it's a very feminized sector. It has high concentration of women, for example, in education. 58% are women in the teachers, nurses, 57% are female nurses. Now, the early childhood facilities and nurseries is very privatized in Palestine. The public kindergarten system was introduced only after 2017. Now, its implementation is very limited in the West Bank. In Gaza, there hasn't been any public kindergarten due to the political division. And even looking at the Palestinian labor law, there isn't any recognition of unpaid care and domestic work, nor any policies that support the redistribution of it at scale. So what happens is that women are concentrated as workers. They are usually informal workers, so they suffer from wage discrepancies, absence of contract. In the public sector, where public teachers, men are the one who receive like family allowances. So there is also discriminatory policies, and there is acute gender pay gap, particularly in the private sector. Now, look, having all this back our mind is important before digging a little bit deeper into the impact of COVID-19 on care work in OPT. Now, what we see is that COVID-19 was not the game changer, or it's more of a risk amplifier to the already existing systematic functionality that existed in OPT. What happened as a result of COVID-19 is that the Palestinian Authority increased its borrowing with another $400 million. There is also an accumulation of governmental debts to private sector that reached, due to COVID, to 1.5 billion. Now that includes debts to healthcare services such as hospitals. So what you can see is that when there is public debts to hospitals, they do not pay their workers fair wages or minimum wages, and they do a lot of cuts for their workers. What we also seen since COVID is Israeli increased withholder of Palestinian tax revenue, and it was estimated that this policy will increase public deficit to 1.7 billion. Now, another replication of the impact of COVID is that about 100,000 Palestinian families entered the poverty line and become dependent on Ministry of Social Assistance. And what we've also seen about 500,000 Palestinians were not able to access essential health care services during the pandemic, including elderly and pregnant women. Now, that left the responsibility of taking care of these groups to the household level, and usually is shouldered by women and girls. Now, if we zoomed a little bit on the Gaza Strip, we will find that during the pandemic, and while people were experiencing the pandemic also experienced the 2021 Israeli military offensive on the Gaza Strip that resulted in a displacement of about 100,000 people, and women reporting an extreme increase in unpaid care and domestic work. Now, moving a little bit to what kind of responses that has been taken for the pandemic by the Palestinian Authority. The Palestinian Authority took over or undertook about 27 policy measures. Now, the focus of the policy measures were mainly on social protection, on a little bit of labor market participation, and gender-based violence. Most of the nature of these interventions are related to cash-based transfer, increase in food packages, expanding the people benefiting the national cash transfer program. But if we looked at analyze these policies from a gender lens, and the UNDP had a gender tracker that really looked at analysis of these policies from a gender lens, you will find that only half of these measures were gender sensitive. So, for example, targeting divorced women in food aid, or raising awareness on gender-based violence, or strengthening services for gender-based violence survivors. But only one policy out of these 29 policies looked at people who are in need of care. So, and even that policy was very short-term, which targeted like 47 centers with food and hygiene items. The only policy that has been taken in terms of addressing the unpaid care and domestic work needs. Now, the PA considered that including some of the groups of care workers within its cash assistance program as a targeting and addressing the needs of the underpaid care workers. If you really looked at these interventions, you will find them very short term. It does not provide sustainable solution, not even like foundation for policies to work on the long term. And even the cash assistance has been very limited, like one-time cash assistance of $200 for the people and workers who have lost their jobs. Now, considering the nature of aid dependency in OPT, you will know that during the crisis, a lot of donors and INGOs, international organizations, had jumped into addressing some of the needs. And I'll address them in a bit. But another policy that the PA has done is issuing an order allowing the flexible working for hours for working mothers. Now, that was a good step. However, it does not support the redistribution of unpaid care and domestic work between men and women. It does not support the redistribution of that labor between household and the state. And also, even though this policy was or order was put in place, there was no measures to reinforce or implement this order in private sector that employs 65% of working women. Not only that, the order in itself does not acknowledge that women who are not mothers also have care responsibilities to their parents, to their nephews, or others who are in the family who need support. Now, the Palestinian private sector were among the actors who were there in order to respond to the pandemic. With support from the Palestinian Authority, they established Outage Fund, which is an emergency fund to support a response to COVID. Now, if you look at the funding of Outage, you will find that it's a very small contribution from private sector. And if you compare that contribution from private sector to the tax exemption benefits that the private sector took in 2018 and 2019, you will find that the benefits they took from tax exemption is 10 times their contribution to this emergency fund. And even these contributions represent only about 4% of their of the total revenue of 43 Palestinian companies. So it does show a huge inequality in wealth distribution and the lack of policies in a place that support the redistribution of wealth among Palestinians to support the needs of the ground. Now, as I said, civil society and NGOs were among the main actors who provided insight into or support during the pandemic. Now, most of their work was, some of them adopting paternity leave, but because don't have paternity leave within the Palestinian law, work is not one of the areas that they are focusing on, and their process. However, looking at all the design and strategy that was put in place, it does not consider gender needs strongly, nor even address. I'll be finishing. And nor does it even consider the care needs of the communities. We are witnessing the new establishment of new cities, part of the reconstruction process, but nothing feminist economic policies at the household, private sector and state level. And we also think that there is a need for coalition building at the care economy level to push for government adaptation of care transformative policies, including social protection, care-related benefits, modification of the Palestinian labor law. There is also currently a talk about revitalization, the social security scheme that is completely care blind. So that is a momentum where we can push for more of the inclusion of unpaid care and domestic work and its recognition in the social security system. And another aspect that we looked at is the importance of exploring tax deduction and waiver on items and products that help reducing the load of unpaid care and domestic work responsibilities. And lastly, aid is a very important actor and aid donors in the Palestinian context. So there is a responsibility in order to ensure that gender consideration and care needs are being taken into account in reconstruction and infrastructure design, particularly in sector related to water, energy, and transportation that would reduce unpaid care and domestic work. Thank you so much for listening.